Welcome back to AM Northwest. Our next guests are changing lives one smile at a time. And here to share what goes into a full mouth makeover, please welcome back from Sleep Dentistry Defined, Dr. Heath Lampee, along with denturist David Chiovelli. Good to have you with us. Let's start first with you. What does it take to rehabilitate a mouth? You say it takes a team, right?
It takes a team approach. I am the dentist who does a lot of the surgery and preoperative planning. But we also, a lot of times, will need an anesthesiologist to get our patients sedated so we can do this really, really complex work. But what a lot of people don't think of is who's going to make my teeth and how are they going to be as perfect as possible? How are they going to fit well? How are they going to look? And David here is the guy that makes that happen.
You're a denturist, and as I understand it, dentures today are not what Grandpa was wearing back in the day.
Yeah, no, not at all.
How are they different?
Well, there's been a lot of, obviously, recent advancements in all the materials and everything that we have nowadays. And that went into dentistry as well. So we used to have materials that were really hard, but they fractured. So that wasn't good. Then we had materials that were soft, but they were too soft and they'd wear down. And now, over time, what's this happened over the course of many, many years, decades of work and research and development, they've come up with teeth now that kind of have the best of both worlds. They have hardness, so they last a long time, but they also have softness, so they're not too hard in your jaws and the rest of your mouth.
So they fit better and they look better,
yes,
right?
But the thing is, we're also connecting them with implants, so they're not going to fall out when you're laughing at a movie or at dinner with your friends. I have a lot of patients that come to my office, and I'm not joking, they, out of their pocket, they pull out their teeth and say, I can't wear my teeth. They don't look right, they're loose, they fall out. So that's what they do. I call it the pocket denture. And so we want to make sure that you're not going to have a pocket denture. You're going to have something that is strong in your mouth.
So David, rather than having a set of dentures that you put in with adhesive or some kind of glue, a strip or something.
Yeah, that's really cumbersome.
These pop into your jawline or into your gum line?
Yeah, what happens is an implant will go in, and you can have different styles of implants. And you can have ones with single teeth on them, but you can also have, for the person that has all their teeth missing, you can have a few of them placed across the jaw, and then they can snap directly on to those.
And they hold in place just with that friction of the snap?
Yeah.
They're extremely secure. It was funny, I was just, this morning before I got here, I was talking to a patient who, we finished his case yesterday after working on it for 3 months, and he was driving back to the coast. He came all the way from the coast for it. He said, Doc, I ate a hamburger and fries on the way home from the office. And he was just thrilled beyond belief because it's solid, it's strong, and I mean, he looks so good too.
Let's take a look at some before and afters, and you can tell us what you did here, or what it represents.
So this is Irene, a great lady, and her teeth had become just really, really poor from genetics. She had soft enamel, and she's fairly young too. And so we had to basically start again. We had to remove all the teeth. We placed implants, and we gave her these new implant dentures that lock securely in place. And she's stunning.
Yeah.
I mean, she's so confident now.
Oh, it's got to make her feel better. Oh, this is a great before and after.
And this guy, this is Ken, and who kind of in the same boat, his teeth were just falling apart one by one, and people over the years had tried to patch his teeth and patch his teeth, but it wasn't working. So he came to us looking for a better solution. So we did the tooth removal, the implants, we gave him a new set of teeth, and he's loving life right now.
Do they stay in 24/7, or you still take them out to clean them and, you know?
We usually leave that up to the patient, however they feel comfortable. When you have it sitting in there and it's locked into place, you can do whatever you want. So it's kind of nice to have them out once in a while sometimes. Some people feel a little bit better having them out, you know, maybe just for a little bit of time during the day just to give yourself a little bit of a break. But when they're in there, they feel so good that people just love keeping them in.
Yeah, it's just like they don't realize that they're not their natural teeth.
Yeah.
And it's incredible.
It becomes...
It is really
that's exactly
basically
what it
part of it.
Well, if you'd like more information, Sleep Dentistry Defined, their number is 503-646-2273, and we'll have information on our website at katu.com. I love the new technologies. Thanks for coming in today.
Thanks so much, guys.
Thank you.
Thanks.